A man in his fourth decade of life presented for elective repair of a brachial plexus injury. The patient had recently been hospitalized for a COVID-19 infection, including ICU care with endotracheal intubation and mechanical ventilation. The patient was brought to the operating room, was induced under general anesthesia, including muscle relaxants, and was easy to manage with face mask ventilation. Direct laryngoscopy was undertaken, and a size 7.5 endotracheal tube was passed easily through the larynx but could not be advanced into the trachea. A second attempt with direct laryngoscopy and a 6.0 internal diameter tracheal tube had the same result. A flexible intubating scope tower was brought to the operating room, and a subglottic stenosis was diagnosed. The otolaryngology service was urgently consulted. Suspension laryngoscopy was undertaken, and balloon dilatation of the subglottic stenosis was performed. The case continued with repair of the brachial plexus injury.